here, and I very much appreciated the previous presentations. I think they've touched on, within the adult world, a lot of what I see in the juvenile world. I currently work down at Oregon Social Learning Center and get to split my time between research down in Eugene and also get to do our services. We are also a service provider in the Lane County area, so I get to see both sides of that world. And what people have been talking about in terms of adult correction and might be thinking about with juveniles, not only is this a prevention group for the adult offenders, since we know there's a high rate of penetration, we also know from some of those earlier presentations they were talking about the high rate of juveniles now getting incarcerated as adults. And so I was asked to come and talk a bit about kind of how kids are different and what the research shows about kids and reentry. I think the main thing that's different about kids is that a lot of the presentations this morning focused on the variability in future offending that is inherent in the individual. When we look at a 30-year-old who's out stealing cars, we focus treatment on that 30-year-old. When we're looking at a 16, 14-year-old who's out doing criminal behavior, we have to look at the multiple systems within which that child is embedded. The kid brings something to the table, but that isn't the lion's share of the variability in future offending. The lion's share of that future offending and the variability comes from the other systems, the family, the school, and the community in which those kids are embedded. Not only are those kids embedded in those multiple systems, but those systems then get served by multiple providers. And so we have housing and child welfare and juvenile justice, drug and alcohol, mental health, all these different systems. And just like one of the previous speakers was talking about in terms of all the silos that people aren't communicating with. So we'll have a family who has a child referred to juvenile justice placement, another child referred to child welfare placement. And when housing comes back to review that family's situation, they'll look at there being no kids in the home and stepping down that family's housing. Then later, when we want to release those kids back to the family, they're now in a single bedroom house. And how do you release kids to that facility? And the family will be looked at as not eligible to get those kids back. These agencies don't necessarily talk to each other as we're doing planning and moving forward. And it creates problems because of that lack of coordination. There's good research that not only are these kids embedded in these multiple models, embedded in these multiple systems, but the actual interplay, where the action is in terms of treatment, has to do with the interplay between those systems. It's not focusing on the kid, not focusing on the family, but focusing on the interplay between those systems where the biggest bang for the buck occurs. Teaching families how to advocate for their kids in school has a greater amount of efficacy than just teaching the parent how to deal with their own situation. There's good evidence, for instance, that parenting can serve as an insulator for kids in terms of their peer group. Good parenting can insulate kids from bad peers, and that's variable from one community to the next. That's variable based on the neighborhood in which that family finds itself. You can have a very strong family, but if it's a really bad neighborhood in which you live, that family insulating factor has less power. So these ecological models, the strongest models at predicting behavior, take into account these multiple systems in which the kids are embedded. At best, what we do when we incarcerate a kid is we're focused on those. A good model in incarceration, we're going to be providing treatment to that child, by and large. But we're removing the child from all of these other ancillary systems. We're removing them from their family. We're removing them from the community. We're removing them from their peer group. And in fact, we're creating an artificial peer group composed of a lot of other kids who've been doing the same kinds of things. And there's really increasing strong evidence that that's going to make a bad problem worse. So by and large, how can we keep these kids out into those communities? How can we teach them what they need to know? I got the opportunity before I worked down in Oregon. I worked at a residential center. And if you want to teach a kid how to be a good residential center person, that's a really good place to teach them how to be an inmate or how to be a future felon. If we want to teach kids how to be community members, family members, community members, students in school, we need to teach them in the community, in the school, in families, and teach them how to do it in the place where we want them to generalize that skill to. The other thing that goes on with kids, different from adults, I think, maybe not entirely, but has to be a big part of our thinking, is that the kid does not remain static during this time. If I incarcerate a 30-year-old and I release a 35-year-old, the world has changed around that person, but the person is, in many ways, quite the same. If I incarcerate a 12-year-old and release them when they're 20, there's a lot of developmental milestones that child has passed during that period of time. That's when we learn how to do a lot of things in life. And if the child has been removed from their family and removed from the community and is reintroduced at a later developmental stage where we haven't let them have those experiences and they haven't had that formative education and haven't been bonded to peers. I had the opportunity, we work with a treatment foster care model down in Eugene. I had the opportunity to work with a group from Detroit, Michigan. And they laughed at me when I said that what we do down in Eugene in terms of skilling kids up is we take them out and we teach them to go bowling. And we have them do beating activities. And they said that was great in Eugene where the big crime is cow tipping. But in the big city of Detroit, that wasn't going to play. A year later, we talked to them about what were they doing with those kids. And they were taking them bowling. And the girls were beating. And they were doing paint your own pottery. And they were doing the same kinds of things because these are kids. And whether they exist in an institution or whether they exist in the community, they're kids and they have developmental needs. They're changing during this time as well. And important things about how they're learning about their environment. And if they're doing it in a facility, that's quite a bit different than doing it in the community and doing it within a family. We know that the most effective youth programs are ones that account for this multi-causal nature of youth behavior problems. It is not, most kids are not have behavior problems because of one and only one problem. It's a complex of things going on in the multi-generational history that come to bear to produce that kind of behavior. Kids bring something to the table. There are sometimes genetic predispositions. There are early life maturational and nutritional kinds of factors that might come to play. There's also things in their early childhood development in terms of whether the parents were there, whether they were smoking and drinking, whether they were involved. All these things come to bear. And there's no single causal dimension. The best kinds of youth programs, if people come forward and say that this is the thing, if we could just teach this one skill, we'll solve for youth crime, that's not going to work because each kid is going to come to the table, maybe the same table, but come to that table in a different way and from a different factor. A good example of that is there's really good data on juvenile drug courts, increasing data that these juvenile drug courts are a good idea. I'm sure most of you are familiar with this, but the idea behind a juvenile drug court is that instead of just popping into the judge, getting a sentence, and then going out in the community, you're checking back in with that judge and there's accountability. The people who do multi-systemic therapy from South Carolina had tried to use MST as an adjunct to, instead of just bringing the kid into juvenile court, to the drug court, and having them be accountable, what happens if you also apply multi-systemic therapy to that, and bring the family in, and teach the parents how to deal with those kids' behavior, and in fact monitor peers and drug use and some of those other things. What happens if you add to that, in the third condition, what happens if you add to that also contingency management? Give them the movie tickets for having clean urine screens. If we can incentivize and had contingencies for positive behavior, teach the family how to do it, and have the accountability of the judge, what happens? And what they found, they had a nice design, randomly assigned these kids. These were pretty involved kids. These were not lightweight offenders. And what they found was that drug court was more effective than family court. I think they knew that going in. But that adding the MST, adding these multi-dimensional components, looking across these systems, and being able to look at the impact of including family education, including peer group kinds of interventions, these things enhance the effectiveness of that drug court contingency. Adding the contingency management to the treatment, to the MST condition, also enhanced the effectiveness. And that not only did it enhance the effectiveness, but those things were sustained across time. That the drug court plus MST plus contingency management produced more positive urine screens down the road, self-reports, et cetera. So the kids not only were doing better, but those effects were maintained across time. And that those things seem to be, each one of the conditions seem to produce an incremental improvement in the behavior, in the effectiveness. And this is self-reported delinquent behavior, showed the same effect as the urine screens. So it looks like that doing these kinds of effective interventions are really positive things. We know drug court is better than family court. Checking in on a multiple baseline is better than checking in once. But then what we can start doing is adding these components together and looking across the multiple systems to improve those outcomes. To most effectively intervene, so what we need to do is identify what our target group is. Are we looking at a prevention or an intervention kind of an intervention? What are we needing to do here? Is this a universal prevention that we're trying to accomplish or a targeted intervention? And the treatment needs to focus on either a single or a multidimensional focus. And we know that with prevention,